This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending December 17th, 2020. This week, I'm going to divide my talk into three parts: the growth of the global pandemic, cases, hospitalizations, and deaths in the United States, and the status of the pandemic in our region. Globally, the pandemic continues to grow, hitting almost 1.7 million deaths worldwide, 75 million cases, and a 5% increase in the past week. And if you follow this line, it looks like it's starting to get a little bit steeper. And if you look at the week-to-week percent increase, what you can see is that after obviously growing very quickly early in the pandemic, for quite a while in September and October, it was running at about 3.5% a week. And then it has moved up to about 5% a week. That may not seem like a lot, but at 3.5%, whatever you're looking at, your number of cases will double in 20 weeks. At 5%, it'll double in about 14 weeks. So that's a very significant difference, especially if it continues to grow over time. At a 5% week-to-week growth rate, we'll expect to get to 2 million deaths worldwide in about a month, and we should double by the middle of March 2021. So this is still a very serious and growing pandemic. Early in the pandemic, the cases were in China. Then this is green, that's Europe. So in the early part of the spring, there were increased deaths in Europe. Then for much of the summer, it was the Americas, North and South America, that dominated. But you can see now that about 7 to 8 months after the original spike in Europe, we're seeing another cluster of deaths there. And this pattern is fairly consistent in the most impacted countries in Europe: Belgium, Italy, Spain, the United Kingdom. You see this increase in deaths in the early part of the spring, then very, very few deaths in the summertime, and then a resurgence in the fall. The good news is it looks like that resurgence is coming down, at least in those countries where it's most mobilized. We don't know why this happened. There's a couple of reasons. Some have suggested a seasonality. Well, if that's true, of course, you would expect to see it continuing here and not coming down. Others have suggested that maybe it's during the summer months when they were very locked down and they're simply being exposed now, people that weren't exposed otherwise. The other idea, and one that's gaining increased currency, is that the virus may be mutating. There's a good report out of England that they're dealing with a mutated virus that may be spreading more easily. The only good news in this is it looks like the spike, the number of deaths on a daily basis, hasn't quite reached the same level it was in the spring, but certainly something to keep an eye on. We haven't quite seen that pattern in the U.S., so we're starting to see something somewhat similar. If we look at cases, hospitalizations, and deaths, remember the sequence is first you see cases, a couple of weeks later you'll see hospitalizations, a couple of weeks later you'll see deaths. In terms of cases in the U.S., this is in July 24th, we'll put it week to week, and the darkest counties are the ones where there's over 500 cases per 100,000. Not a lot going on for much of the summer, and then you're starting to see this clustering in the North and South Dakota, Wisconsin, and then it starts blowing out from there and increasingly moving out back to the areas it was before, particularly in the East and West. You see this most dramatically if you look at every 4 weeks, starting on July 24th, August 21st, September 18th, not a lot, but you're beginning to see a little increase there and here. Then you're starting to see this clustering in North and South Dakota and Wisconsin, then in the entire upper Midwest, and now back spreading into California, the East Coast again. So this pandemic is not going away. If you look at the cluster of cases in the U.S., it looks like, maybe we're seeing a little bit of that same pattern they saw in Europe. As I've said many, many times, I'm not a big fan of using cases because it depends on how many tests you do. But hospitalizations and deaths don't lie. And if you look at the increased hospitalizations, after going fairly steadily, it looked like it was slowing down, then speeding up and slowing down. And now for the last couple of months, speeding up again. And we can see that in this week-to-week percentage, again, sort of coming down. And now it looks like it's coming back up again. And then deaths, of course, follow that. The U.S. has had over 300,000 deaths from COVID-19. And again, you can see in the last month or so this ticking upward, and you clearly see it here. We are starting to see this pattern now. About 8 months after the first spike, we're seeing a second spike. In our case, it looks like the numbers are a little bit higher than they were back in the spring, and we had this interim spike. And I think this has more to do with the size of the U.S. and how the pandemic is spreading across the country. We're much larger than most of the European countries. Of worrisome note, though, is that in the last week, the percent increase is 6.1%. That's the highest weekly increase we've seen since early June. So this week-to-week increase is what tells me that this pandemic is not yet slowing down in our country. At 6.1% week-to-week growth rate, we'll get 400,000 deaths in about a month. That's very significant. And our region is not spared, of course. Tennessee said this 6,000 deaths, Virginia about 4,500, North Carolina, Kentucky. This doesn't tell us a lot, but if you look at deaths per million, you'll see that Tennessee is about 50% higher than our surrounding states. I can't tell you why that is. It's just an observation. And it does tell us that whatever we're doing right now isn't working. Virginia has had a lower week-to-week growth rate, often around 5%. And you can see it just sort of goes up and down. Perhaps you can look at a pattern of the last month or so of coming back up, but we'll keep an eye on that. In terms of where the cases are in Virginia, the darkest counties are the ones where the most cases are. And now, again, if you've been following these presentations, it has been mostly here in the West, but now we're starting to see it again in the peri-urban areas in the East. Tennessee, on the other hand, is just going through the roof. 11% weekly growth rate is very, very fast. That means doubling in less than 8 weeks, right? We'll expect to get to 10,000 deaths in less than 5 weeks. That is very significant, and a double in about 7 weeks. And what you can see is after running in around the 10% range, it seemed to come down, but then for the last couple of months, it's going back up again. This is very serious. In terms of where it's happening, it doesn't really help us because it's all over the state right now. If you look at hospitalizations, again, you can see this sharp upturn right around here. Week-to-week growth rate in hospitalizations, again, running about 10% and coming back down. Now, ever since early September, the week-to-week growth rate is going up. This tells us that the pandemic is still growing. It tells us that what we're doing right now isn't working. If you look at our region combining North Carolina, Virginia, and Tennessee, you can see we're in the midst of it. Ballard's catchment areas had over 900 deaths with a 12% week-to-week growth rate, which means we'll double in about 6 weeks. This is very serious because not only does it mean people are dying, but it also means that the health system is going to be overwhelmed if we don't do something more effective. The bottom line is that 2 vaccines have been approved in the U.S. That's very good news, but supply and distribution suggests that it'll be at least several months before we can see an impact on the transmission of the virus in our country. The pandemic is continuing to spread and appears to be growing slightly faster worldwide, with over 1.6 million deaths, expected to get to about 2 million in a month. The European countries saw this resurgence about 7 to 8 weeks after the original wave, if you will. It looks like that second wave has now crested, at least in the most impacted countries. We're not sure why this has happened or whether this cresting will remain. The U.S. now has almost 1,000 deaths per million, with growth in virtually all areas and expected to hit about 400,000 deaths in about a month. And our region, Tennessee and the Appalachian Highlands, appears to be at the heart of one of the most heavily impacted areas. And again, we expect a doubling of the total number of deaths by January. The good news is we still know that there are things that we can do to make a difference. So until a sufficient number of people have been vaccinated that we have some level of social or herd immunity, we have no choice but to continue taking the actions that we know make a difference. Avoid unnecessary crowds, especially indoor groups. Wear masks in all situations in which you are outside or around other people. Engage in social distance, which means minimize the amount of time and maximize the amount of distance you are near people. Implement good hygiene. Stay home if you're sick. That's really important. Conduct widespread testing and contact tracing, and of course, pay attention to quarantine and isolation. Protect the elderly and those with chronic conditions, and as always, treat each other with greater kindness and respect. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our listserv, please let us know. We'd be happy to add them. Thanks as always to Melissa White for updating these slides and Dara Young for editing, producing, and posting this video. If you have any comments, questions, concerns, criticisms, please let me know. I'd be very happy to address any issues that you have. As many of you know, I will respond to your emails directly, or I'll incorporate the material into these presentations. But I do look forward to hearing from you. Thank you very much.